We are. तुझे पूछ सकते हैं कि प्रॉब्लम है क्या? नहीं, या कोई भी उसमें नंबर बताएगा कितना वो चला कितना वो नहीं चला, मैं उतना बैंक जाके कर सकता हूँ। गूगल करना हो तो पूरी लेबर वगैरह करोगे, वो देखते उसके ऊपर
also called as a also called as a
सारा सर कंटिन्यू जैसे शॉर्टली बिल्डिंग वाली ओके hi ITG just informed me okay ITG just informed me that the streaming was not done, like the streaming was not happening. Can anyone call me back and tell me, can please anyone call me back and tell me that how much was streamed and how much was not streamed, because I think we lost the connection in between. My phone number is 955 060 1655. Can please any, okay, sorry, don't call on that number. Okay, 988, sorry, the 988 55 45 714. Please call on this number, 988 55 45 714. Can you please call me here and let me know how much is done? In the meanwhile, I will continue the class, assuming that the streaming was going on. Okay, when you lost it, please give me a call at 988 55 45 714. Right. So I was discussing, I'll just start from 3 slides backward from the back. Okay, when should you suspect HIV? When there is a persistent fever, persistent loose motion, and persistent weight loss in high risk population. When we say high risk population, the high risk population is defined as female sex workers, male having sex with male, intravenous drug abusers, sexually transmitted diseases, people with sexually transmitted diseases, and migrant population. History of then there is a history of blood transfusion. Now, coming to diagnosis of HIV, HIV antibody test. Okay, so HIV antibody test is done using different antigen and or with different principle of the test. Viral antigen test used for screening. Viral antigen test is used for screening blood donor in USA. Detection of viral nucleic acid in blood and determining the CD4 count to assess the disease progression. Where should you get yourself tested? ICTC centers are established in district hospitals and medical colleges. The free testing is done. The confidential there is a confidential counseling. Okay, free HIV testing. Yeah, okay. Referral to nearest ART center is done. Is HIV curable? No, HIV is treatable but not curable. Antiretroviral drugs suppresses the virus and improves status. However, the patient remains HIV positive for the life and can transmit the disease to others. Now, what is antiretroviral therapy? Antiretroviral therapy is a combination of all, sorry, it's a combination of at least three drugs from different groups. It works to control HIV replication in the body and prevents the destruction of CD4 cells. Hence, it delays the disease progression, prevents uh, prevent I don't know what it is, but anyway, and reduces hospitalization, reduces transmission of HIV. ART increases survival and quality of life. It is a lifelong therapy, required high adherence, similar to treatment taken for high blood pressure and diabetes. They have certain side effects which should be prescribed by specialized physician. Why should I why should I get treated? Why should I get tested and treated if there is no cure? So of opportunistic early diagnosis, it creates an early treatment of opportunistic infection. It improves it improves survival, better quality of life. Starts with ARV at the appropriate time and decreased chances of transmission of HIV to others. Coming to the treatment, all HIV positive patients do not require treatment immediately. Treatment is started. Treatment is started depending on patient's level of immunosuppression. Degree of immunosuppression depends on patient's CD4 count. Even if they do not require treatment, they needs to be followed up regularly. Where are where are ARV drugs available? ARV antiretroviral therapy program started on 1st April 2004 at 8 institutions. Target under NACP 3, which leads to 300 centers functioning. Currently, 4.07 lakh PLHIV includes 22,000 children alive and on treatment. ART centers provides free drugs for infected individuals. Why? Okay. There is some acronym, but I am losing that. Okay. Then they provide counseling. Antiretroviral drugs. So this is the list of antiretroviral drugs. So I would suggest to please copy it down, and I'll skip the slide after staying on the slide for 10 to 15 seconds. Coming to prevention, how can we prevent HIV/AIDS? Avoid multiple partners, use condoms, use sterile needles each time for injections, Never share needles. Avoid unnecessary blood transfusions. Never buy blood from professional donors. Donate blood, and all pregnant women should be tested for HIV. Now coming to prevention, again it's continuing prevention. Use standard work precautions, hand hygiene, personal protective cares, and proper disposal of biomedical waste, immunization against HBV, and education, health education. So these are potentially infected body fluids, which includes blood, semen, vaginal secretion, CSF, synovial, pleural, pericardial, peritoneal fluids, amniotic fluids, tear, sweats, urine. Exposure to the body fluid considered not at risk are tear, sweats, urine, feces, saliva, sputum, vomitus. Okay. Healthcare workers comes in contact with potentially infected body fluids due to preco- uh, preco- precautionary. I don't know. I'm not able to press to. Okay. Uh, Due to precautionary injury, needle stick cut, for example, needle stick cut with sharp objects, and etc. Uh, Contact with mucous membrane, contact with non-intact skin. Okay, I'll just skip management of exposure site to. Okay, so management of exposure site. The first thing is, do not panic. If it is a skin, wash wound and surrounding with soap and water. Rinse well. Do not scrub. Do not use antiseptic or skin washes. Management of exposure site is blood, splash of blood or opium. In case of eyes, eye irrigation with water and or saline. You, if using contact lens, leave them in place where while irrigating. Remove one's eyes in clean. Remove them eyes irrigation. Remove one's eye is clean. Remove them and clean. The mouth, spit fluid immediately. Rinse mouth thoroughly with water and saline repeatedly. Do not use soap or disinfectant. Personal protective equipment, PEP, personal PEP prescription. Okay, anyway. So, contact ART specialist. Decision of starting PEP is based on exposure type and HIV status of sources. Decide PEP regime, basic regime, expanded regime. That is, basic regime is 2 drug combination, expanded regime is 3 drug combination. If source person is on ART drug, expert should be consulted after starting 2 drugs. Post-exposure prophylaxis are in India. It is recommended for occupational exposures. It should be started as early as possible within 72 hours. ARV is given for 4 weeks. HIV testing should be done at baseline 6 weeks, 3 months, or 6 months. What is the risk of environmental transmission of HIV? No environmental transmission is reported yet. HIV inactivated quickly outside the body, and HIV does not multiply outside the body. Infectivity is lost quickly after the fluid dries up. So where are ARV drugs available? At ART centers established by NACO, 300 ART centers all over India in UP and UP. Okay. ART centers IMS BHU established in 2005. 11,000 registered HIV positive patients. ART centers provides free ARV drugs, free drugs for OI, and counseling. We will continue our class on HIV with the national HIV testing policy from next class, in our next class. It's not much in that. We'll continue with our class. We'll cover that part there.